On men over 50, just 1 minute every morning can restart your testosterone, naturally. Introduction: the reality of hormonal change. After 50, if you're a man over 50, you've likely noticed subtle shifts in your body, energy, mood, or performance. Maybe it takes longer to recover from a weekend project. Maybe your workouts don't feel as explosive. Perhaps your drive, focus, or morning vitality isn't what it used to be. You're not imagining it. You're experiencing one of the most well-documented physiological transitions in male biology: the gradual age-related decline of testosterone. For decades, the conversation around low testosterone has been polarized. On one side, pharmaceutical marketing has positioned hormone replacement as the only viable solution. On the other, wellness influencers have promoted quick fixes, miracle supplements, and exaggerated claims that promise overnight transformations. Both extremes miss the truth. Testosterone is not a switch you flip. It's a dynamic system you nurture. The idea that just 1 minute every morning can restart your testosterone naturally is compelling, but it's important to clarify what that actually means. You cannot magically reset decades of physiological aging with 60 seconds of breathwork or light exposure. What you can do, however, is create a consistent morning signal that optimizes your neuroendocrine environment, aligns your circadian biology, reduces cortisol interference, and creates the ideal internal conditions for your body to produce and utilize testosterone more efficiently. That 1 minute isn't a magic trick, it's a catalyst. Testosterone production doesn't happen in a vacuum. It's governed by the hypothalamic pituitary gonadal, HPG axis, influenced by sleep architecture, nutrient availability, stress load, physical activity, metabolic health, and environmental factors. When any of these systems are compromised, testosterone synthesis and signaling suffer. The good news? Many of these factors are modifiable. The great news? They respond remarkably well to consistency, timing, and intelligent daily habits. This guide is not about shortcuts. It's about science-backed optimization. It's about understanding how your body actually works after 50, why the morning window matters more than you think, how a focused 60-second routine can prime your hormonal landscape, and what supporting habits will determine whether that minute compounds into real measurable vitality. We'll cover the physiology of testosterone decline, the role of circadian rhythms, step-by-step protocols for the morning routine, nutrition and movement fundamentals, stress and sleep optimization, tracking methods, myth-busting, and long-term sustainability. You'll learn what's realistic, what's exaggerated, and how to build a daily rhythm that supports healthy testosterone without relying on guesswork or gimmicks. If you're ready to move past quick fixes and build a foundation that actually works with your biology, let's begin. Chapter 1: The Science of Testosterone and Aging. What testosterone actually does. Testosterone is often reduced to libido and muscle mass in popular culture, but its role in male physiology is far more expansive. It's a steroid, hormone produced primarily in the Leydig cells of the testes, with smaller amounts synthesized in the adrenal glands. From a biochemical standpoint, testosterone is derived from cholesterol through a series of enzymatic conversions, and it functions by binding to androgen receptors throughout the body, including skeletal muscle, bone, brain tissue, cardiovascular structures, and metabolic organs. Its responsibilities include muscle protein synthesis and retention. Testosterone upregulates anabolic signaling pathways, helping maintain lean mass and strength, especially important as sarcopenia risk increases with age. Bone mineral density. It supports osteoblast activity and reduces bone resorption, lowering fracture risk. Cognitive function and mood regulation. Androgen receptors are densely concentrated in the hippocampus and prefrontal cortex. Optimal levels support focus, motivation, emotional resilience, and mental clarity. Metabolic health. Testosterone improves insulin sensitivity, supports healthy lipid profiles, and influences fat distribution, particularly visceral adiposity. Erythropoiesis. It stimulates red blood cell production, impacting oxygen delivery and endurance. Sexual health. It modulates libido, erectile function, and reproductive tissue health, though it's only one piece of a complex vascular, neurological, and psychological system. When testosterone declines, it's rarely just one symptom that emerges. It's a cascade. Lower energy leads to less movement, which reduces muscle mass, which worsens insulin sensitivity, which increases fat storage, which elevates aromatase activity, converting testosterone to estrogen, which further suppresses testosterone. Breaking this cycle requires addressing the root drivers, not just chasing numbers. The reality of age-related decline testosterone peaks in a man's late teens to early 20s. After age 30, total testosterone typically declines at a rate of about 1% per year. Free testosterone, the biologically active fraction not bound to sex hormone-binding globulin, SHBG, or albumin, often declines at a slightly faster rate due to age-related increases in SHBG and changes in liver function. By age 50, many men experience a 20-30% reduction from their youthful baseline. By 60, it can be 30 to 40% lower. This is not a disease. It's a normal physiological adaptation. Evolutionarily, it may reflect a shift from reproductive competition to resource allocation and survival efficiency. However, modern lifestyles, chronic stress, poor sleep, sedentary behavior, processed diets, and environmental toxin exposure can accelerate this decline beyond what aging alone would produce. The term andropause is sometimes used, but it's misleading. Unlike female menopause, which involves a sharp, definitive drop in reproductive hormones, male hormonal change is gradual, highly individual, and heavily influenced by lifestyle. Some men over 70 maintain robust testosterone levels. Some men in their 40s experience clinical deficiency. Age is a factor, but it's not the sole determinant. Symptoms versus lab values. Low testosterone symptoms often overlap with other conditions. Depression, thyroid dysfunction, sleep apnea, vitamin D deficiency, chronic inflammation, or medication side effects. Fatigue, reduced exercise tolerance, increased body fat, especially abdominal, decreased muscle strength, brain fog, irritability, low libido, and sleep disturbances are common complaints. However, these are nonspecific. You cannot diagnose low testosterone based on symptoms alone. Laboratory reference ranges vary by clinic, but generally. Total testosterone: 300, 1000 ng/dl. Free testosterone: 50, 210 pg/ml, lab dependent. HBG 1055, nmol/ll, LHFSH. Help distinguish primary testicular versus secondary hypothalamic pituitary causes. A single blood test is insufficient. Testosterone follows a strong diurnal rhythm, peaking in the early morning, 6 to 8 a.m., and declining throughout the day. Testing should occur fasted before 10 a.m., after adequate sleep, and ideally repeated for confirmation. Many men are misdiagnosed due to afternoon testing, poor sleep the night before, or acute illness. Primary versus secondary hypogonadism. Understanding the type of deficiency matters. Primary hypogonadism. The testes fail to produce adequate testosterone despite normal or elevated LH-FSH signals. Causes include genetic conditions, trauma, infection, chemotherapy, or severe varicocele. Secondary hypogonadism. The hypothalamus or pituitary fails to send proper signaling, low LH-FSH. Causes include obesity, chronic stress, sleep deprivation, excessive alcohol, opioid use, pituitary tumors, or extreme caloric restriction. Most age-related declines lean toward secondary or mixed patterns, meaning the signaling system is suppressed, not the testes themselves. This is actually good news from a lifestyle intervention standpoint, because secondary suppression often responds well to circadian alignment, stress reduction, weight management, and metabolic optimization. The myth of restarting testosterone isn't a machine you reboot. It's a hormone regulated by feedback loops, nutrient cofactors, tissue sensitivity, and systemic health. You can't restart it any more than you can restart your liver or kidneys. What you can do is remove interference, provide optimal conditions, and signal your body to prioritize production and utilization. Think of it like tuning an instrument. If the strings are slack, the wood is warped, or the room is too humid, the sorry note will sound flat. Tightening the tuning pegs, lifestyle habits, doesn't restart the instrument. It allows it to resonate as designed. The 1-minute morning routine is essentially a daily tuning peg adjustment. It doesn't replace sleep, nutrition, or movement, but it sets the tone, reduces noise, and helps your endocrine system respond to everything else you do. When natural optimization has limits, lifestyle interventions are powerful, but they aren't infinite. Men with genetic predispositions, severe testicular damage, pituitary dysfunction, or long-standing metabolic disease may not achieve optimal levels through habit alone. In those cases, testosterone replacement therapy, TRT, under medical supervision, can be life-changing. TRT is not a failure of natural methods. It's a targeted medical intervention for a specific physiological deficit. The goal of this guide is to help you maximize your natural capacity, understand your biology, and make informed decisions. If you suspect clinically low testosterone, get properly tested. Work with a qualified provider. Use lifestyle as your foundation, not your limitation.